Pain at the front of your shoulder, down your bicep and possible clicking could indicate bicep tendon irritation, known as bicep tendonitis or bicep tendinopathy. So in this video, I'm going to tell you what you need to know and do to reduce the pain. We'll look at tests, pain relief and exercises that you can do at home. So welcome to the Physio channel. Let's get started. So we're talking about the bicep. Down here, it attaches to the radius bone in your forearm. And then up here, it attaches deeper onto the front of your shoulder blade. You can see the anatomy image on the screen here. It attaches to 2 points. It attaches to a bony projection called the coracoid process, and then the longer head comes over the top of the arm and attaches to the top of your shoulder socket. Once again, you can see it in the anatomy image here. Now, it's this longer head tendon which is the focus of this video. That's your long head of biceps, and it comes through a groove on the top of your arm here, and this is the area that often gets irritated. Now, most people know the bicep does this, elbow flexion, but it also does this, turns the forearms over into supination. Just think of holding a bowl of soup. And it also assists with forward flexion of the shoulder, so we need to think about those 3 actions when we're performing our rehabilitation. So the problem often occurs here as the tendon passes through that groove on the top of the humerus. And it can also be caused by repetitive strain, so lots of forward flexion of the shoulder, perhaps whilst you're exercising or at work, repetitive overhead activities such as doing DIY or cleaning tasks, for example, and this movement here, so abduction of the arm and external rotation can certainly cause irritation, and that's a bit like a throwing action. So excessive throwing could be something which irritates the long head of biceps tendon. Now, to help cure the problem, it's also important that I tell you about the rotator cuff muscles. Now, these are the deep muscles of your shoulder which help your shoulder to stabilize and to move. In people with irritation of their bicep tendon, they often have irritation or damage to the rotator cuff muscles as well. So you need to know about these rotator cuff muscles and strengthen and rehabilitate them as part of your recovery from long head bicep tendinopathy. So to identify if you have the bicep tendinopathy, remember the key symptoms of pain over the front of the shoulder, possibly radiating down into the bicep, and maybe some clicking and clunking. Now, if the pain here occurred suddenly and a pop was felt, then this would indicate a bicep rupture. One of the key signs that you've ruptured your long head of biceps is a Popeye deformity, as you can see on the screen here. I didn't just make it up, that's actually what the name's called, and don't ask me why Popeye has ruptured his bicep. But if you have this, then make sure you get some medical advice. Next, I'm going to show you 4 simple tests that I would do if you came to see me as a patient, and you can do these tests at home. Test number 1, hold your arm out in front of you and press up. Note the palm of the hand is facing up. If you push up and you feel pain over the front of the shoulder, that would indicate a positive test. Test number 2, this is called the uppercut test, like the punch action. So do the punch action and apply resistance with your other hand. And when you do that, once again, if you feel pain here or clicking or clunking, this would indicate a positive test. For the next test, take your arm back as far as it will go, then place your hand on top of your head and push down onto the top of your head so that you're contracting your bicep. If you feel pain here, this indicates a positive test. For the 4th test, come off the top of your bicep to the top of your shoulder, press in with your thumb and see if you can feel any tenderness at that point. Add to the test some rotation of the arm. If you feel any tenderness or clicking or clunking under your thumb, this is indicative of a long head of bicep tendinopathy. This is not a very specific test, but it does help to confirm the area that's tender. Now, you may be wondering, should you get a scan? Well, if you can, you've got 3 options. Ultrasound may show if the tendon has ruptured or come away from the bicipital groove. X-rays only show bony changes, but they may show some calcification of the tendon, and they may show some bony spurs, which could of course be irritating the tendon. And MRI scans, very detailed, but don't tend to be used for long head of biceps tendinopathy. Now, most people don't need a scan for this type of shoulder problem, and an unnecessary scan can leave your shoulder pain feeling worse. If you're not sure what I mean by that, then I'll put some notes in the description. Now we're going to look at some rehabilitation options. Now, there's no proven scientific protocol for bicep tendinopathy, but using tendon science and biomechanics, I've put together a 2-stage plan for you. The first part, we're going to look at pain relief, and then the second part, we're going to tackle some strengthening, rehabilitation and return to function. So for the first 2 weeks at least, make sure you avoid anything which aggravates the symptoms. These are most likely to include biceps if you've been doing those, excessive forward flexion activities, repetitive overhead activity, and remember that throwing action where the arm is out to the side and externally rotated. so avoiding that action as well. Avoiding these for a couple of weeks should help to settle the symptoms. You might go and visit your GP, who could offer some anti-inflammatory tablets or an injection, and that may help. You may also wish to try this simple taping technique. So have your arm by your side and slightly back if that's not painful. If it is, bring it back by your side again. Take some tape. Here I'm using some rock tape. I'll put a link in the description. Peel away the backing paper and then place the tape over the front of your shoulder. And then gently stretch the tape. I'd recommend about 30%, leaving the last piece of tape with no stretch. So this bit here is lightly stretched by 30%. There's no stretch at the start and there's no stretch on that last piece of tape. Rub the tape to secure it in place and activate the adhesive. Okay, so that's the tape applied. I'll put a link at the end of the video and in the description to some other shoulder taping options which may actually be better and offer you more pain relief, but you will need an extra pair of hands to apply the tape. Now the next thing I'm going to show you is static muscle contractions, known scientifically as isometrics, and the research shows that these help to reduce tendon pain. And I can tell you from experience that they often do, especially around the shoulder. So it's very simple. Here's what you do. Bend your elbow to 90 degrees and use the other hand to provide a force. Push forward into your other hand and push forward and maintain that push for 30 seconds. It's a static contraction, so even though you're pushing, you're not actually moving through range. So hold that for 30 seconds. For the next one, you're going to do resisted outward rotation. So use your other hand to provide a block and push into that hand. So you're trying to push this way, but this hand is stopping you. And do that again for 30 seconds. Hopefully you've guessed what the next one is. Instead of pushing out, this time you're going to push in, using this hand once again to provide a block. So pushing in, that inward rotation for 30 seconds. This one is usually pretty easy to do. And then you want to push back. So to provide the block, put your arm across your tummy there, put your elbow on top of your hand and push back against your hand and push for 30 seconds. Now when you do these, you should notice some pain relief. If you do, you can do any one of these four a little bit more to get a bit more pain relief if you find that beneficial. So for example, if you found pushing out was particularly helpful, then you could do a few more of those. Otherwise, do all four for 30 seconds, 3 times a day. It's very simple, but if you do it, the research shows, and from experience, it's most likely to help reduce your shoulder pain. One final point on this section, although I said to avoid repetitive overhead activity, it is important to keep your shoulder mobile. So make sure you stretch your shoulder at least a few times a day just to maintain the mobility. That's very different than excessive repetitive activity. You're just simply taking the shoulder through range to make sure that it doesn't stiffen up unnecessarily. So after your symptoms have settled, hopefully after a couple of weeks, you can move on to the strengthening. Now I'm going to show you 3 exercises, and then after that, I'll share with you how many reps and sets I recommend you do. So the first exercise is a rowing action. Now if you don't have any equipment at home or available to you, then take a rolled up towel, wrap it around one leg, sit up nice and straight and pull the foot towards you. Pulling your shoulder blades back together and pushing your chest forwards. And this, as you can see, is a simple rowing action with your leg providing some resistance. Hopefully you can find or purchase some exercise equipment. So I'm going to use here a resistance band. I'll put a link in the description to some examples of these. So with this now, the resistance is provided from the elasticity of the band, and I can get a slightly better range of motion, focus on pulling my shoulder blades back and pushing my chest forwards. This next exercise has 2 parts. Make sure you're happy with part 1 before you progress to part 2. So part 1, take a light to moderate weight. You could use a bag of sugar if you're struggling to find anything, and hold that at shoulder height. Now part 1 is to slowly raise that straight up above your head. Just make sure you don't hit the ceiling. Raise that straight up above your head, hold, and back down. When you're performing this, stop if you feel any pain, but low levels of discomfort, perhaps a 1 or 2 out of 10, are acceptable at this stage, as long as the discomfort doesn't last after you've done the exercises. Once again, push up and hold, and down. When you're happy with that, and if that's okay to do, part 2, what I want you to do is perform that action again. Take the weight up above your head and hold it as straight as you can, and then perform a half squat by bending your legs holding that weight straight above your head before returning upright again. The third exercise is the table press. So use a raised, sturdy surface, such as a table or side of a sofa, for example. Place your hands just wider than shoulder width apart, and then keep your elbows straight. Let your body drop down between your arms by letting your shoulder blades squeeze together, and then push away so your shoulder blades spread apart. And this is described as a straight arm press up, because you're doing a press up type action without actually bending your arms. So this is part one. Hopefully this should be easy enough for you. When you're ready, progress to part two, which is where you go down into a half press up position and back up. If you feel your shoulders tender when you get to a certain point, then just perform the exercise within the pain-free range. If you feel okay to go a bit deeper without any significant shoulder pain, then go a little bit further down, even all the way down if you want to. Now, to make the exercise a bit harder, you want to just lessen the angle a bit, which you can do by taking your feet further away. So you've got more weight going through your arms and therefore more resistance when you perform the press-up action. And if you find that easy, you can progress to lower angles and then progress to doing press-ups on the floor. So those exercises should be enough to get you started. I'd recommend doing them 3 times a week, between 6 to 12 repetitions, 3 sets with a couple of minutes rest in between. Now there's some other great exercises that I'd recommend you do for your shoulder. If you remember, we said that it's important to strengthen up those rotator cuff muscles. And although those exercises will achieve that, it's a good idea to do some of the other classic shoulder strengthening exercises. So I'll put some recommended videos at the end and some links in the description for you of some other recommended shoulder exercises which may help. Before I go, here's a few tips. When the pain is reduced and your shoulder's feeling a bit stronger, you can return to perhaps overhead activity if you need to do some DIY or work or exercise related tasks. But do limit it on a daily basis and make sure you don't do too much and don't try and complete a task at the expense of re-aggravating your shoulder. Then if you want to return back to doing bicep curls because that's part of your training plan or you enjoy doing those, then once again, once the symptoms have settled by at least 90%, you could return back to doing some bicep curls, but make sure that you start with a lower intensity, maybe 60 to 70% of your previous intensity. Gauge the response, see how you go, and then hopefully increase from there. But don't just jump straight back into your training using the same weights and intensity that you were when the injury occurred. Now, before we go, you may be interested to know what the surgical options are for long head bicep tendinopathy. One is a tenotomy. This is where they cut the long head, allow it to slide down through the groove. It reduces the pain. It may cause a bit of dysfunction and weakness because obviously you've lost one of the key parts of the bicep, but it does also create that Popeye deformity that we looked at earlier. And this is a common procedure. The other one is a tenodesis, where if they have performed a tenotomy, then they reattach that long head to the top of the arm, somewhere near the pec attachment. This, of course, gives you more function, more strength, as well as hopefully still reducing the pain. So that brings us to the end of this video. I'll put those other videos on the screen here and some helpful links in the description for you as well. Please don't hesitate to get some medical advice. This was just an educational video. Otherwise, please do share this video with anybody else you know who may have this problem. Thanks for watching the Physio channel. We'll see you in the next video.